Right, good. I'm going to reshare. All right, so as I was saying, coronavirus nothing to do with corona beer. That was a joke at the first place, and some people actually thought coronavirus came with the corona beer. So they were saying, well, just bring Miller Lite and you'll be okay. So, but now we know coronavirus is a much more serious thing. So, what is coronavirus? Well, first of all, coronavirus is not a virus. It's actually a family of viruses. The earlier ones were SARS and MERS. Um, when China was hit by COVID-19 back in January and December, they found that the virus can be transmitted between animals. Can be transmitted between animals and people. And now you just saw in the news today, there's one tiger at one of the zoos. The tiger apparently has COVID-19. So it's the first case seen, I think, anywhere in the world that actually they think the virus got transmitted downwards to the animal. So the common signs, fever, cough, shortness of breath, breathing, we'll go more into that. And as the thing progresses, the person can have acute respiratory issues, kidney failure, and even death. Started in Wuhan, China in December 2019, with the first case recorded December 1st, 2019. The World Health Organization officially declared COVID-19 to be a global health emergency on January 30th, and the virus got its name officially on February 11th, 2020. I'm going through these fast because it's kind of gives just a brief idea, just regroup where we all are. The most common symptoms, fever, fatigue, dry cough, loss of or reduced sense of smell. Other symptoms, person can have aches and pains, nasal congestion, sore throat, diarrhea, nausea, shortness of breath. Can you guys hear me well? Yes?
Yes.
Okay, I'm not going too fast, right?
No.
All right, good.
If people who are making noise would please mute themselves, it would be really helpful. It's hard to hear otherwise.
Everyone should mute.
Yeah, can everyone just mute yourself? Perfect. Because I thought on my side I could, but I can't find it. So, let's see. Yeah, okay. You know what I'm going to do? I'm going to do a stop share and then go in and try to mute you all here. All right, I am now in control. I like control. All right, so back to symptoms, okay? So what you're seeing is that some people get infected, but the ones that get infected, most of them don't even have symptoms at all. We'll talk more about this. 80% or more recover from the disease without needing any kind of special treatment. And 1 out of 6 people actually become seriously ill and starts developing breathing difficulty and will then need the ventilators. Older people and those with underlying medical problems were the ones that got infected. The reason I say were the ones was that was a situation that they saw in China. Well, we're seeing a whole different situation in the United States, and I'll talk more to that also. If the person presents with fever, cough, difficulty breathing, right now generally says seek medical attention, go get tested, and then make sure everything's okay. I just had actually today some really good news. A couple of my friends and patients, they did get tested, and both of them came back negative. So that's a win. So it's really good. And both of them were on a Chinese herb, so that's wonderful. So this slide actually is just a little summary, okay? It's a slide produced by the CDC, okay? Patients with COVID-19 have mild fever, cough, shortness of breath. The symptoms can appear 2 to 14 days after exposure. And if you've been in China for the last 2 weeks, this is way back in before it hit the US. So that part is no longer valid. Now, let's take a look. Let's regroup first. What do we know from China? From China, and this is very much similar to the US, okay? They found that of all the symptoms, fever was the biggest one. Then they had dry cough, fatigue, and then the person started producing sputum, shortness of breath, muscle pain, sore throat, headache, etc. But fever was the number 1, followed by dry cough. And we'll take a look and see what's going on here. How does this spread? Well, it spreads mainly aerosol by coughing and sneezing, okay? Also by touching a surface, so you can pass human-to-human contact. And of course, close personal contact will have that issue too. And in rare cases, contact with animals and stuff. So, and this is a picture that shows, coughing, wheezing, and touching people. So how does it kill? Well, this is a summary of what happens. Okay, person starts getting all the symptoms, headache, cough, fever, running nose, and as it progresses into the body, eventually the person can develop pneumonia, and then ARS, and then leading to kidney failure, and then death. So I'm going to break this down to help you understand how it actually progresses inside the body. So think about this, okay? The virus goes into the body at two different stages, I call that. The first stage is a preliminary stage, which is called, and these are terms that I didn't make these up. These were made up by China in their 4-phase approach to treat COVID-19. The first stage, they call it influenza, where the person starts getting little flu-like symptoms, what does that mean? Well, the virus invades the body, it comes in via the lungs and via skin openings in the body, such as your eyes, your mouth, the pores. Okay, if you have the skin cuts, they can invade via that also via the other openings in your body. For women, you have the vagina. For men, you have the penis. They can also go via that. So any kind of opening will have that. Yes, Mary. You can unmute yourself. Are you able to talk, Mary? Let me see if we can. You are muted. So unmute. Oh, I can't unmute you. Looks like you have muted yourself.
Oh, unmute now.
Okay.
Can you hear me now?
Yes, I can hear you.
Okay, someone's eating that's not muted. And so I keep hearing smacking, chewing.
It's Ellen on her iPhone.
Okay.
Everyone needs to mute, put their device.
Sorry, I thought I was muted. I'm sorry.
Okay, no worries. Okay, I'm going to mute again.
Okay, great.
All right.
Thank you.
I can reduce that.
Okay, I've hit the mute all button on my side, okay? But at the same time, you folks also have the ability to unmute yourself if you had questions and things like that. So, okay, so we continue. So now the virus invades the body. It comes in via the lungs and via the skin openings. And then when it invades the body, comes in through the lungs, the person starts developing flu symptoms, which are loss, decreased sense of smell and taste, chills, sore muscles, fatigue. The person kind of feels off. It's like having a cold, start having dry cough, scratchy throat. And as that gets worse, penetrates deeper, the person starts having fever and feeling warm. The scratchy throat now starts becoming more sore throat. Their fatigue and sluggishness gets worse. So that's the first stage, influenza. As it gets deeper, it now goes into the next phase, which is the pneumonia stage, which presents with more serious flu symptoms and pneumonia-like symptoms, which as the virus goes deeper into the body, okay, it goes in through the same pathway as flu. It damages the organs. It can cause congestion and fluid buildup in the body. We'll talk more about that. And then eventually can result in pneumonia and organ failure, which of course then leads to death. So the symptoms the person will have: high fever, sore throat, wheezing, shortness of breath, extreme fatigue, diarrhea, weight loss, reduced no appetite, fluid congestion, phlegm obstruction, kidney failure, and then organ failure, and then death. So let's see what actually happens there, okay? So in summary, what happens is in the influenza phase, the virus attacks the lungs. So what happens at that time? The person starts having flu-like symptoms. Well, the body now goes into a defensive mode. the body now starts trying to battle the invading pathogens. The immune system kicks in. The virus, if you remember, if you look at the picture of the virus, they have those little spikes, right? Those spikes end up allowing the virus to actually attach themselves to lungs. And it has been shown that these can then cause scars and damage to the lungs themselves. So as the virus is attacking the lungs, meanwhile, the body's main defensive organs are revving up to try and attack the virus. The kidneys support the lungs in constantly helping to make the lungs nice and moist, because lungs don't like dry. The lungs cannot function with dry. So the kidneys are one of the primary supporting organs for the lungs. So that's why if patients have asthma, we always treat the kidneys to support the lungs. So the kidneys go into play. The spleen, as you know, is the organ that produces the white blood cells and is the keeper of the body's immune system in the blood. So both of them kick into gear. So both of them now are being worn out, working overtime. So when you look back at the statistics of people, especially coming from China, what they found is that the people that have an underlying kidney-related diseases or digestion-related diseases, these people are more prone, because what happens is as the virus is attacking the lungs, attacking the body, the kidneys and spleen are kicking into gear. But if these organs themselves are also weak, they get weaker in trying to, attack the virus. Well, the significance of that is this. The kidneys and spleen both have a very important function. The kidneys, as you know, is a keeper of our body's urination system. It works with the bladder to get rid of all the toxicity in our body via urine. When the kidneys weaken, the person's ability to start to urinate starts slowing down. So as a result, fluid buildup in the body starts going up. The spleen affects digestion. So when the spleen starts getting weaker, the spleen's ability to work with the stomach together to convert all the fluids in our water, in our liquids, and our fluids back to fluids that our body needs goes down. As a result, the person ends up retaining fluid. So therefore, when the spleen and kidney both are getting weaker, the person starts retaining fluid, A, because the fluid is not converted by the spleen, and secondly, the kidney is unable to get rid of the excess water via the urination. What happens then is the fluid buildup starts building up from the abdomen up. That's why they call this a lower respiratory disease. It's coming from the bottom up, not from the top down. So that's why the body starts building up and the person starts having fluid congestion, which then brings it to the pneumonia phase, which more serious flu symptoms come in, but people are also going to see the pneumonia symptoms are the congestion fluids building up in the lower body. Person starts having shortness of breath, wheezing, person starts not being able to breathe. And if you look at the patients that are being treated, they'll tell you that their shortness of breath and wheezing is not coming from the throat, is not coming from the lungs, but coming from the abdomen going up. And then eventually what happens is that they start developing acute respiratory distress syndrome, which is ARDS. So in this case, they really have problems breathing. They literally are drowning in their own congestive fluids, which then results in death by pneumonia or also death by kidney failure. These two are the biggest, killers of people by COVID-19 because the kidney eventually can no longer sustain it. The spleen can no longer sustain it, so then you can have organ failure in that aspect. So far, so very good? Follow me what I'm saying? Yeah, okay. So I just want to give you an idea, because if you look at this, then if you're able to look at the progression of COVID-19, it's not that scary. It's not like the bacteria virus comes right into you, and all of a sudden, next day you drop dead. There is a progression that the virus has to go through. So if we're able to stop the virus at the influenza phase or before the influenza phase and prevent it going to the pneumonia phase, well, then we're pretty much good. That's why the majority of the people, when they're sent home, okay, is no different from you having flu. What happens when you get flu? Well, You are asked to stay home and just rest, right? Don't drink ice stuff, eat warm foods and get a good rest. And then you recover. A few days later, you go back to work. That's the same thing. So that's the influenza phase. COVID-19 is no different. The only thing that makes it more dangerous than the general flu is because it's very, it's very aggressive, and those spikes damage the lungs, whereas the flu doesn't. So I'm going to give you a simple situation of how things happened back in China. This is Macau. Those of you that know me know that I was born in Macau. Macau is a low port city on the coast of China, about 700,000 people, about 3 square miles, so a very small place. So in Macau, I still have family there, and most of my high school friends are there. They logged their first case in January 23rd. Now, to understand Macau, what I'm about to say, Macau has always been considered the gambling mecca of Asia. It's considered like Eastern Monte Carlo, so it functions like Las Vegas. So their main industry is tourism and gambling. This will play a part in a second when we get there. So the first case logged on January 23rd, and on February 4th, they logged their 10th case. At that point, the governor of Macau says, you know what? I need to do something drastic. We have to stop things from happening. So they did, and I'll talk about what they did. After they implemented their stuff, February 4th on, they had no more new cases. The total cases logged to date was 10. The total cases cured was 10. So what did they do? They had no deaths. So what did they do? Well, they shut down all the casinos. And this is a big deal. Why was this a big deal? It would be equivalent of Las Vegas shutting down all the casinos. When they did that, the media was quick to let people know MGM Macau shut down the casinos because of coronavirus. Well, it was a big deal, but they shut it down because they wanted to get control of everything and to prevent further exasperation because of people coming in. So they shut down the casinos, they restricted travel, they shut down all the massage parlors, bars, and nightclubs. You might say, well, why massage parlors? Well, in Macau, massage parlors, there are two types. One is for massage, and the second one is for some extra benefits other than massage, if you know what I'm talking about. So they had to shut down the massage parlors. And the bars and the nightclubs, because over there, smoking was prevalent. So bars and nightclubs tend to be very smoke-ridden. So they just literally shut that whole thing down. They closed government, schools, offices, businesses briefly for a couple of weeks, and they rationed masks and gloves. Now, this is something they did really smart. What they did was they had every resident have an ID, and that resident was able to go to a certain place, whether it's a pharmacy or whatever, to buy masks. Each resident was allocated 10 masks every 10 days. You had to present this ID. You present that ID, you get your mask. Once you purchase that for that period, it's done. You have to wait till 10 days later. That way, they prevented people from hoarding masks, and they pretty much regulated control over there. So this is basically what they did. And the most important thing is they used Chinese medicine for prevention as well as treatments. Remember, this was back in January and February. No vaccination like us now. No medication, okay? Hydrochloroquine didn't even exist at that time over there. So everything they did was stay home, wash hands, and use Chinese medicine and Chinese food therapy, and just using food as medicine to help boost the immune system. When I look back at what's happening in the US, and a lot of you have heard me say this all the time, the biggest weakness we have here is people are not educated on how to get themselves strong. That is what we really need to do. Washing hands is important, but how do you get yourself strong? That is the weakness. So part of what we're going to do in the second half here, I'll give you some idea of what you need to do. Okay? So I just want to show you a sample situation in Macau. Macau could very easily have gone haywire because sanitation does not exist in Macau. Hygiene does not exist in Macau. How do I know? I grew up there. I used to eat noodles sitting on the side of the road with cars going by me, and I'm just squatting there, having my bowl of noodles and eating like this while the cars just keep going right by me. And then when I'm done, I give the noodles back, the bowl back to the the person that was making noodles, and he would wash it. You know how he washes it? Using just a basin of cold water. He'd rinse it and then give it to the next person. That's sanitation in Macau. So Macau was a huge risk for really exploding, but they didn't. And again, this showcases two things. Number one, the fact that people need to know how to take care of themselves. And the second thing is they were fast in going down and shutting things down, which we're doing right now, and preventing the thing from exasperating. And the most important thing you can take away from Macau thing is that it shows you that it's scary, but it's really not scary. Let's look at a situation today. Here, I was just downstairs, having dinner with my family, and they're talking, Fox News was showing we have 1,000 something deaths and how many new cases. Well, this is the cases today, okay? There's 1.331 million cases in the world. Total deaths is 73,000. Total recovered is 275,000. Now, let's think about this. A big portion of these were, especially the deaths, were back. Actually, no, China was around 3,000, so I can't even say that. But if you look at these here, total confirmed cases, 1.3 million, 73,000 were deaths, okay? So that's about 4 or 5%. The rest recovered 275,000. Well, what about the remaining 1 million, right? They're right now being recovered. They are being treated. And if you really look at that 1 million, how many hospital beds do we have? Not that many. What does that mean? Most of these people are where? At home, recovering. So what this is telling you is this virus is contagious, it can be transmitted, but at the same time, it can be killed by our body's own immune system. And what Western medicine is also finding out is that they are starting to see if the plasma from the people that have had the virus and they recovered from it, if their plasma could then be used as antigens into the current patients that are suffering from that and helping that. So that's basically almost using the plasma from the patients that have recovered as almost like a vaccine. So the good news about this is that our body itself is strong enough to battle against this virus. Because if it's not, and with no vaccine and with no medication, the death toll, 73,000, would have been much higher. Do you see where I'm coming? So I hope you guys take that into, we need to, we're being surrounded by a lot of doomsday and death and stuff like that. When you really look at it, this is real. This is what's happening. There is hope, it's not as bad and gloomy as people say it is, but we still need to be cautious, and we still need to help ourselves by preventing and also by strengthening. So we're going to be talking a lot about that today. So what can we do? So this is the second part about that. Well, the first, you're limited in what you can do with the environment, but you have total control over your immune system. My patients hear me say that ad nauseum. I can say, I tell my patients these more than I tell patients to wash their hands, okay? Because this is really true. You can't control your environment that much, but you can control your body, okay? You walk out the door, you have your face mask, everything on, and you walk into a store, and all of a sudden, someone, achoo, right in your face, and, oh, no problem, I'm all protected. I got my glasses, I got my face mask, I'm protected. Well, you forget you have your hair, the stuff lodged in your hair. And then you go home, well, how many of you wash your hair at night? Not many, right? So if you don't wash your hair at night, where do you put your head on? Your pillow, right? All that stuff is now on your pillow. Then next thing you do is take the pillow and you swoosh your face inside that. So you just inhale everything inside you, right? So you can only control the environment so much, but you can control your body's immune system. That you have total control. I was talking to my wife earlier, and she made a very good point. She says, people have to really start learning to look at themselves, because vaccine, no vaccine, great. Guess what? Today we have COVID-19. In the past, we had Ebola, we had SARS, we had MERS, we had avian flu, et cetera, et cetera, et cetera, et cetera. Well, when COVID-19 is done, do you think that will be the last one? No, we're going to get another one next year. Then what are we going to do? Go through the same exercise again, try to panic and start looking for vaccines and stuff? Probably. But what if we have, through this exercise, learned how to strengthen our body? Wouldn't that be a much better option for all of us? Think about it. So what can we do? Well, health tips. The first thing that is on here are the primary recommendations, and these are the ones that you all know. That's in the mainstream. You hear this ad nauseum every day. Wash hands. I'm sure every one of us have enough knowledge about washing hands that we can all write a Bible. We can call it a Sarasota version, 1 through infinity of how to wash hands. Maintain at least 6 feet distance. When I put this slide together first time in February, it was 3 feet, so now 6 feet. So the current virus has gone a little bit more airborne. Wear a face mask, okay? There's still the argument wear or not wear. But you know what? When it was first came over here, they were finding that it wasn't as airborne. Now they're finding it's more and more airborne. I think part of it is not because the virus has gone more airborne. I think it's because there's more people carrying it, which reduces the distance between people, so that now it may still be 3 feet distance, but if more people are carrying it, you get more of that population of virus in the air, making it more transmittable via the air. And then you avoid touching your nose, your eyes, your mouth. Cover your nose, mouth with your bent elbow or tissue. We'll talk more about this, okay, when coughing or sneezing. Stay at home if you're not doing well. Keep track of the latest COVID-19 hotspots, okay? New Jersey apparently is becoming a big one, and I just read somewhere today that they are projecting Florida to be the epicenter of COVID-19 once New York gets their act together and things are under control. Minimize travel during outbreak, disinfect surfaces, okay, especially places that they are frequently touched where possible and practical, and avoid contact with people who are ill. And if the COVID-19 symptoms are present, get tested and self-quarantine. Nothing here you don't know. You all know this, okay? You can memorize these by heart, okay? If I gave you a test, you all would come out A+. So what else are we going to talk about? Well, this is my top 10 recommendation. Number 1, avoid ice cold and cold food and drinks. Only hot, warm fluids and food. Why is that? Well, in China, back in January, they found that in taking a look back at around 53,000 cases that they investigated, they found that the COVID-19 flourished best when the lungs were around 8.9 degrees Celsius, which is about 40 degrees Fahrenheit. They also found that the COVID-19 starts getting significantly weakened when the lungs temperature in the lungs are around 27 degrees Celsius, which is about 80 degrees Fahrenheit. So what did they decide to tell people to do? Start drinking hot fluids, warm fluids, eliminate all ice cold stuff, eat hot foods, don't eat ice cream, and don't eat cold stuff. And with that alone, they found they actually controlled the virus and weakened it. And in fact, in Chinese medicine, we know those that understand Chinese medicine, there are 2 things significantly weaken the lungs: cold stuff and dry stuff. And we'll talk more about the dry stuff afterwards, okay? So the cold stuff and the dry stuff. So it's no surprising here that the COVID-19 is able to penetrate the body when the lungs are weakened by cold foods and things. So I'm going to bring this to a situation that I mentioned earlier. You know, in China, they were saying that 80% of the people that came down with the severe cases of COVID-19 were 65, 70 and above. All right, this is in China. These days, we're seeing people 20, 30, 40, even babies, okay? And a lot of young people, teenagers, 18, 21, they're starting to come down with it. And there's more and more articles saying that the people that are being treated in the hospitals are around the 30, 40-year-old age group. My thought about the reason why that is the case, in the United States, people don't drink cold water. They inhale ice like there's no tomorrow. They drink everything ice. And guess what the group of people in the age group 20 to 50, what do they drink most? Ice, alcohol, beer, ice cold drinks. They make smoothies, they make juicing, and they make a lot of smoothies. They put ice, they crush the ice. Everything is ice, 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 ice. Whereas in Asia, the younger generation, they know to drink room temperature or hot stuff. If you go to China, Hong Kong during the summer, you know, you go to one of the local restaurants, it can be 90 degrees outside. You sit down and you're in a restaurant, you want to order something. Guess what they're going to bring to you? A glass of hot water. They're not going to give you ice cold water. Give you a glass of hot water. That's what it's like over there. So when I look at the contrast, I really see a correlation between all the cold foods and all the bad stuff that injure the lungs that are eaten here and not eaten in China, especially with that younger generation. The ice stuff, the cold stuff, the spicy stuff, the dairy, all the dairy stuff. The older people, they don't eat that much dairy. Why? Because their body can't handle it. It's not because they don't want to, they can't handle it. But the young people, they eat nothing but just dairy, 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 dairy. So that's why you're seeing that's such a huge change of demographics between here and China. So the first thing is avoid ice cold drink, ice cold foods, and consume only hot and warm fluids and foods. And this actually is really nice because you're seeing more and more of Western doctors today and Western medical practitioners starting to advise people, you know, drink more hot, warm fluids. I was told by a patient last week that even Dr. Oz was promoting it. I said, yes, good score for the good of America, you know, good for that. So that's number one. So number two is avoid foods that are dry, spicy, and phlegm producing. The lungs do not like cold stuff, and they don't like foods that are dry, spicy, and phlegm producing. It injures the lungs. So what are they? Foods that are dry include foods that are baked, roasted, barbecued, grilled, and broiled. These are very dry. They make your lungs dry. Think about what happens to you if you go into a room that's very smoky. You start coughing. Your lungs can't handle it. Okay? So that's why when you, after you are eating all these baking, roasting stuff, you get very thirsty because it dries you up. The foods that produce phlegm, most of them you already know, dairy, deep fried, oily, high in sugar content, fatty, okay? You don't want to help COVID-19 to weaken the lungs. You want to strengthen the lungs. So you want to try to avoid weakening your lungs and also try to avoid producing phlegm in your lungs. So that's number two, okay? Number three, zinc is a major enemy of COVID-19. I mean, you hear this a lot, but this was actually found in China, okay? What you hear one of the symptoms that people say, especially the patients these days that are in hospital, you'll notice a lot of them say, you know, one of the first symptoms we had was a diminished or loss of sense of taste or smell, right? Zinc deficiency presents with a loss of taste or smell. So what China found was that because of that symptom, they identified that a lot of the people that were prone to COVID-19 were actually deficient in zinc. So they start telling people, well, try to eat foods that are more zinc. Difference in the United States rereads that and says, go buy as many supplements as you can that are zinc. That's why when you go to the stores, you don't find any more zinc supplements anymore. But my answer to that is, don't buy the zinc supplements. Just eat the foods that are rich in zinc. And some of you already have this document that I sent out. This is a list of foods that are rich in zinc. I did not build this list. This list came from the NIH. Okay, so I am going to go ahead and at the end of this this talk, you guys go back to where you guys came from, like whether it's my Facebook page or wherever. Just say, hey, Dr. Rene, can I get a copy of this document? I will send it to you. Okay, don't worry. Okay, because a lot of my patients, a lot of people online already have this. This is what you need to have. Is real food. Let your body absorb what it needs. Let your body get rid of what it doesn't need. These are all the foods that are rich in zinc. Of course, you don't want to eat all of these. there's stuff inside there like Swiss cheese, and not the best because that's also dairy. So use your brain. Don't say, oh, Rene said no dairy, but he said there's zinc. Well, no, I can eat that. This is inside this list. No. Use your common sense, okay? So zinc is good, but dairy is not good. So don't go straight to this and look at cheese and that, okay? So that's zinc. Vitamin C is another one that they found in China. And I can't remember if it was in the Wuhan or the Hubei hospital, where at that time they were just desperate. They were trying to find anything that works. So they said this is a Western hospital. They're saying, well, vitamin C seems to help with people battling flus and colds. Let's see what happens if we give them high doses of vitamin C. So they gave their patients intravenous and high dosage of vitamin C. And they found that number one, it weakened the virus. And number two, it helped those people that were on ventilators recover faster. So vitamin C now become another option for the hospitals, and the Chinese group, they sent this out to the other countries and letting them know, hey, vitamin C along with zinc, these are good options for helping the body boost. Again, vitamin C supplement versus vitamin C foods, I'm always going to go for the vitamin C foods, okay? And I don't need to talk about the foods because you guys know more about vitamin C than I do because I just eat the food. So protection against radiation, 5G is a concern. Some of you have probably heard about the concerns about 5G, right? So I'm going to share something with you here, and I really think that there is a correlation between 5G and COVID-19. First of all, I'm not saying COVID-19 is caused by 5G, not the least. However, 5G played a part in this, and this is from my research, okay? So I'll share with you. China wants to take the lead in the 5G race. So by the end of 2019, it had installed 130,000 5G antennas throughout the country. At least 10,000 antennas installed in Wuhan alone. Just give you a comparison, US has about 10,000 in the whole country. They installed that amount in Wuhan alone. So Wuhan is the #1 province with 5G antennas. Zhejiang was the second most hit province. And Zhejiang there are 3 cities inside there that had a lot of these cases, okay? And they were all the trial cities selected to trial the 5G networks. Now, other findings was that there were some coincidences in terms of timing. The rapid pace of the epidemic developed in accordance, kind of proportional to the number of 5G antennas getting higher and higher. Coincidence? Maybe. Don't know. China's first 5G smart city and smart highway, i.e. Wuhan, happens to be the epicenter of the epidemic. Is that a coincidence? You figure. Epidemic only became rapidly more severe as the numbers of 5G antennas skyrocketed. So what does 5G do? It weakens the immune system significantly. Europe has already proved this on and on. Patients living outside of 5G zones in China, they have hardly any symptoms or very mild symptoms. Again, coincidence? You decide. Over 10,000 5G antennas installed in Wuhan in the months leading up to the outbreak, meaning that right along the time going to the outbreak, all of a sudden you have this massive 5G interference there. Cities with the highest rates of coronavirus infection tend to have recently deployed 5G networks. 5G may be making the virus even more severe. So let's think about this potential scenario, okay? There's a lot of theories how COVID-19 started. I'm with the theory that it started with the bats, with the stuff, because I grew up in China. I saw people eat bats, dogs, I had snake soup growing up, They take the soup, they cook it and take a snake, cook it in soup. It's a delicacy in the winter. It keeps us warm, okay? In fact, some of the stuff you see here in restaurants, eel, okay? Some people eat eel. Well, you can see eel as potentially one of those rare animals too. We don't know. But there are a lot of those types of animals there. Now, picture this situation. Let's say in Wuhan, okay, this one guy in the beginning of December, he had a contaminated that his immune system was weak, the virus came in. Well, guess what? If 5G had an effect in weakening the immune system, then his immune system would have been significantly weakened by the 5G, so that he might have had previously an opportunity to resist the COVID-19, but because it was weakened by 5G, he now is not able to. Now he's able to pass it on to other people because the other people's immune system also weakened. There's a big possibility that that is the case. Is it true or not? Don't know. But 5G is a concern. You just have to look at the doctors and the scientists that do research in Europe. And there's a lot of concern about 5G. I personally have a lot of concern about 5G too. So there's more and more talk about the liaison between 5G and COVID-19. So I want to put it here, regardless, 5G and just EMFs, you know, the radiations, the Wi-Fi's and stuff, they can all affect our immune system. So there's a lot of solutions out there that you can help to boost your body's immune system against it. Selenium has been proven to help the immune system. A lot of foods have selenium. You can read up the, how do you call it, ask Dr. Google foods that are rich in selenium, okay? The other thing is these days they have more and more, I don't have it here, but they have more and more of these like little bracelets or rings or necklaces or even things that you plug in the wall or even put in the back of your phone that they say deflect radiation, EMF deflectors. Exactly, like that, yeah, well, yeah, so Heidi showed that exactly. So those are really good. I have one downstairs that I paid about $60. It supposedly deflects radiation up to 1,500 square feet, okay? People ask me all the time, does it work? I said, I don't know. I said, do I care? No, because if it doesn't work, I'm back in square one, right? But if it says it works and it does work, I'm protected. If it doesn't work, I'm still unprotected, but at least I'm trying. And I know it's not affecting me. But I can tell you, especially the ones behind the phone, you put it behind the phone and you notice, literally notice, the phone doesn't get as hot when you talk into it. If you don't put it on, it gets very hot. When you start putting into it, it doesn't get that hot. So it's doing something. So those are those things. Take a look at that. There are other doctors. I know Dr. Mercola, a very famous natural doctor. His natural products are, you know, very, very popular. He has one suggestion. I totally agree with him. He says, in your room, don't put any Wi-Fi equipment. Take the Wi-Fi stuff out of your room because you're sleeping. When you're sleeping, your immune system is the weakest. So stay away from the EMF generating stuff in your room. I totally agree with him, okay? So things like that. Number 6 is exercise and de-stress, okay? Exercise calms your mind down. De-stress calms your mind down. Exercise also helps to promote the circulation. Your circulation is your best mode of defense. When you stress, stress affects the circulation, which affects your immune system. So the more you're able to de-stress, the better you are. You boost the body's immune system, you strengthen the lungs, the kidneys, and the spleen stomach. Why do I single these 3? Because based on the slide I said earlier, you remember I was saying the virus attacks the lungs, starts coming into the body. The body's initial line of defense are the kidneys and the spleen and stomach. So the spleen and stomach and the kidneys are weak, the virus are now going to go deeper and really going to attack you. So the people that have been succumbing, especially in China, they found that diabetes people, that's a kidney condition. Prostate, that's a kidney condition. Hypertension, that's a condition of the kidney and the liver. So a lot of these issues they find are directly tied to the kidney. The older people, as we get older, our kidneys start going downhill. No one can escape that. I can't. No one on this call can. No one on earth can. It's normal age of progression. But what we can do is there's a lot of foods. These days, America is being, how do you call it? I won't say obsessed, but really infatuated with bone broth. Bone broth is huge because bone broth strengthens the kidneys. Kidneys manage the bones. So we believe that if we drink soups made with bones, especially with marrow, we are taking in the constituents that actually help to strengthen the kidneys. So that's why strengthening the kidneys is important, strengthening the lungs is important, and of course, strengthening the spleen and stomach is important because it strengthens our body's immune system. And then there are a lot of, everyone here will have your own thoughts about how to strengthen the lungs, the kidneys, and spleen and stomach. Go for it. How you do it, doesn't matter. Go for it, okay? That's the important thing because you can strengthen your immune system as much as you want, but if your organs cannot support it, that immune system will break down. It's kind of like you having a wall, but you don't have any soldiers protecting it. You got to have nice, strong soldiers constantly reinforced. Then people cannot penetrate that wall, okay? Don't just focus on immune system. Focus on your body's organs as well. I'm a big advocate of consumption of green tea with ginger and white tea. The best way for strengthening the spleen and the stomach is the consumption of green tea. Ginger strengthens the stomach and spleen very, very dramatically. But try not to use more than 2 slices of raw ginger, thin slices. Because if you use more than 2 slices, ginger is very spicy. It can be dehydrating. And it can dehydrate the stomach. And then it can cause dryness. And then it can in turn weaken your spleen and stomach. Okay? So 2 slices is best. And I'm not recommending any of those boxes that says ginger tea and stuff. They're not real ginger. That's just ginger taste. You want them medicinally, you need the raw ginger and you need to boil it. Okay? So green tea strengthens the spleen and stomach. Ginger also strengthens it, but ginger also has an additional function. Ginger is the #1 herb for getting rid of toxicity in the stomach, which is why when you eat sushi, you eat ginger. Ginger is the #1 food for seafood poisoning. So when you eat sushi and there's raw fish, people eat ginger to get rid of all the leftover poison from the raw fish. So when you eat green tea and ginger, you are truly strengthening your stomach and trying to get rid of a lot of the yucky stuff that's inside your stomach, okay? Which is why ginger, some of you may know, ginger, a lot of people eat ginger to help with diarrhea. Why do you think it helps diarrhea? It's not, ginger doesn't affect diarrhea. Diarrhea is the body trying to get rid of the yucky stuff in your stomach. You take the ginger gets rid of the yucky stuff. Guess what? Diarrhea stops. The body says, yucky stuff gone. I don't need any more diarrhea. That's the power of ginger. White tea in China is called the emperor's tea. In the old days, the tea leaves could only be found in the high parts of some of the mountains. And the emperors were the only ones that had the ability to send the soldiers up there to go out, go amongst the thieves and the criminals and actually get the flowers and bring them down. Normal people could not. So that's why emperors, the white tea was considered tea of the emperors, and it was revered for its high antioxidant content. So white tea in China is known for its ability to strengthen the immune system. These days, fortunately for technology and transportation, we can all get white tea. But if you take a look at the cost, white tea is going to be slightly more expensive than green tea or black tea. That's because of its high antioxidant and medicinal property. Okay, so leverage antiviral. I know a lot of you have essential oils. Leverage antiviral essential oils and foods, including foods rich in iodine. Okay, because they found that iodine in the Western medicine, there's a cytokine cytokine explosion that happens when the lungs get affected and scarred. The cytokine reaction then ends up resulting in a lot of the fluid buildup inside the lungs. They have found that the iodine actually helps to inhibit those proteins that are responsible for causing those cytokine explosion. So in other words, by taking more iodine, they're able to inhibit the cytokine explosion and be able to help with preventing this from getting worse. So what is good in iodine? My favorite is just a seaweed snack. Those seaweed snacks that you can get at a Trader Joe's and stuff, the seaweed paper, that's high and rich in iodine. And it's also high in fighting against cancer. So that would be something good to have. Other than that, there's a ton of foods that's good for our diet. So stick to that. And then get enough sleep. Okay, get enough sleep. Now, one more thing I meant to mention also is along with the 8 and 2, raw vegetables are actually very bad for the spleen and stomach. Raw vegetables will injure the spleen and the stomach. So the recommendation is not to eat raw vegetables, not to eat salads, but have the vegetables cooked, especially in soups, stews, and steam. Okay, there are 3 reasons for that. Number 1, raw vegetables are very difficult to digest. So when you eat a lot of raw vegetables, the spleen and the stomach spend all the time trying to break down the vegetables and digest them. It takes away the other function of the spleen and stomach, which is the production of blood and production of the white blood cells. So that's why you see people that eat a lot of raw vegetables that tend to be anemic. They tend to be blood deficient, iron deficient because of that. Second thing is raw vegetables are cold-natured energy-wise. The spleen and the stomach, the whole GI area, needs to be 98.7 degrees Fahrenheit for the stomach, the digestive process to be optimum, and for the gut flora to be healthy. So when you eat a lot of raw vegetables, they are cooling in nature. It cools down your spleen and stomach. It makes that environment not good for digestion. It also makes that environment not good for the gut flora, which is why if you eat a lot of raw vegetables, the body will reject it. You will get diarrhea. You will almost never ever see constipation with raw vegetables, but you will see a lot of diarrhea with raw vegetables. That's also the same reason why dogs will eat grass when they need to get the toxicity out of their body. They eat the grass, the body gets rid of it, the toxins, everything comes out. When everything's out, they will not eat grass again. We try to push them, they'll eat your hand instead. So, and then the third thing is there's this thing called goitrogens. Raw vegetables are very high and abundant in goitrogen. And the leafy greens are the worst. And high on top of the leafy green is kale. Kale, when cooked, is the most beneficial of all medicinal vegetables, when raw kale is the most toxic. That's why when you eat kale, it's rubbery and it's very bitter because of its toxic properties. So when you eat a lot of kale, you are inhaling a lot of goitrogen. So what does goitrogen do? You can look it up. Goitrogens do 2 things. They inhibit the production of thyroid hormones, and they actually damage the thyroid. So that's why people, when they eat a lot of raw vegetables, they will present with thyroid problems. So to battle COVID-19, we talked about the lung, the kidney, and the spleen and stomach. So you want to keep the spleen and stomach as strong as possible. Raw vegetables will weaken and damage the spleen and stomach. So if you love salads and stuff, at least during this time, stick with cooked vegetables. You can worry about your celiac and other stomach GI issues later on. Okay? So right now, just consume cooked vegetables. So you go to the next group. Other suggestions. These are my other ones. Some you know, some you don't know. First of all, don't elbow bump. Why do people elbow bump? Exactly. Some of you, achoo. So when what did doctors tell you to do if you're sneezing? Achoo. Right? And then when you open a door, what do you use to open a door? Use the elbow, right? What do you lean on in the elevator? You lean on the wall on your elbow, right? How many of you right now have the laptop on a table, okay? What are you putting on a table? Your hand or your elbow? Probably your elbow. When you sit on a restaurant, exactly, I think you put your head on a table right there, right? So it's like, when you say like that, guess what? My elbows are on the table. So everywhere you're outside, you have your elbow. So why would you want to rub your elbow against someone else? That's the dirtiest part of your arm. Your hands are significantly cleaner. So don't bump elbows. In addition to that, don't ass bump. Okay? I mean, same thing. Where have you been sitting? Right? I mean, you see a lot of the healthcare workers at the hospitals, they're lying on the floor, sitting on the floor. And then I actually saw two nurses, on Facebook, they're bumping each other's butt, I say, why? You were just sitting on the floor. What's on the floor? People's spit, people's cough, snot, everything. I think I was on the floor. Why do you want to bump people's butt, right? So don't ask bump. So if you really need to touch each other, use the inside of your shoe. Just do a shoe bump, or just do like the Japanese do. Hi, 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 like that, okay? Or just say hi like that, all right? So consider wearing gloves, especially dishwashing gloves. And gloves is I say this because one of the things about people wearing masks, one of the things in the beginning, they say don't wear masks because they say, yeah, have a high chance of touching your face if you wear a mask. It's true, because when you wear a mask, the mask is loose. You're always fiddling it. When you're fiddling, what are you doing? You're touching your eyes, you're touching your nose, right? And if your nose is itchy, what do you do? Right? What happens if you have some bacteria in your finger? You just went and scratch, guess what is now inside your mask? Right? Now, when was the last time you touched your eyes or your nose or your mouth with gloves on? Get my point? Never, right? Now, gloves are very rare these days. They're one of the equipment that medical doctors and people use. We're dishwashing gloves. I have a pair in my car, so when I go out to the grocery store and buy food, I put my dishwashing gloves on. I may look stupid, I don't care. I'm using that. I'm holding on some number one. It's easy to take off, much easier than the latex or rubber medical gloves. And secondly, dishwashing gloves are water resistant. You can wash them, put them in hot water, kill the bacteria. You can put soap, put whatever you want inside there, soak the whole freaking glove in the whole bottle of Lysol. You still be okay, right? And then you can reuse the glove. Best of all, these gloves are only $2.99. Cheap. So wear those types of gloves if you have to, okay? Leave your shoes outside the house when you come home. I can't tell you how many people don't do that. Again, think about what I was talking about, the elbow bump and the ass bump, okay? The dirtiest part of your body when you come home is your shoes. Think about every single ground that you stepped on, right? Snot, food, everything, pee, poop, feces, okay? Everything. So then you come home, walk in with your shoes on. Well, guess what? You just trampled everything now all over your house. So just leave your shoes outside the house. Disinfect your clothes, etc. when you first come home. Okay, what I do is like when I come home, like from the clinic, okay, when I come home, I go straight, I take my shoes off, I go straight up to the bathroom, okay, and I get out of my clothes, they go right into my basket, and it's gonna go straight into the wash. I jump into the shower, whole body wash, hair wash, I'm clean. If I'm out and about, not in the clinic, not at these high-risk places, but like maybe just going to a grocery store or going to the gas station, okay, I'll come home, what do? I still do the same thing. I go into my room, I get out of my clothes, I get into clean clothes, I take my dirty clothes, I take them to my lanai, I put them outside under the sun. I leave that there till I go to sleep at night because I'll let the ultraviolet light try to kill it, okay? So you gauge how dirty you think your clothes are, okay? And I'm insistent on that with anyone coming to my house. My sister-in-law, when she came to stay with us 2 weeks ago, I told my wife, she's coming, she's welcome. But first thing, she comes here, she's going to come right to the front door. She's going to take her shoes off. She's go straight there into the gas bathroom. She just jump right into the shower. All her clothes, everything into the basket. Okay, she has clean clothes there. Then she can come in. Then we can. So things like that. So disinfect the clothes when you first come home. Leverage the sun and the ultraviolet rays. Okay, leverage that. Ultraviolet kills bacteria. Okay, heat is also not good for the viruses. You hear this discussion a lot outside. We're coming closer to summer, and the heat is coming up. And then there's a lot of debate whether the warmth is going to have any kind of impact on the COVID-19 or not. Well, here's the situation, I believe, okay? First of all, it depends where COVID-19 is. If the bacteria is on the surface of things, yes, the heat and the ultraviolet can kill them. But if the bacteria is inside the individual, in the lungs acts as a shield. People can still be the carriers. So on one hand, the summer and the heat may slow it down in the spreading, but what will really, really, truly slow it down, contain it, is if the people can get rid of them from the lungs, not from the outside. Otherwise, they become carriers, okay? It's similar like, well, it's 120 degrees outside. Do you care? No, because you're inside, you have the AC down to 75. You don't care, right? So you like the bacteria inside, outside is hot, don't care. But if you're outside, you probably die of heat. So use your own pen and stylus device when touching, touch devices. And what if you don't have that? I always suggest to my patients, use this. Where's my camera? Right here. This knuckle, use that knuckle. Because when you touch the knuckle, okay, this knuckle is going to be significantly cleaner than here. It probably has not touched anything since the last time you washed your hands, as long as you don't do this, right? So if you do this, next time you go wash, you have lesser chance of getting contaminated via stuff here than via stuff here. So if you have absolutely no other choice, no stylus, and you have to touch something, use your knuckle, just like that. Best is to just have your stylus and pen device. I mean, especially for women, they have their pocket books. God knows what you carry inside that. You have your rocks, you got your boulders, you got your little stuff. Is like this whole thing is like 50 pounds, so you'll have room for a little stylus inside there, and then just put it inside your pocket. Get as much fresh air as you can. Okay, oxygen helps keep our organs strong, helps keep the blood moving. And when I say fresh air, especially people that live in Florida and live in the humid places, and especially like San Diego, I don't mean going to the ocean. Ocean is humid air. Humid air, there's more of the hydrogen inside, less of the oxygen. It's not as oxygenated. For fresh air, you need to go where there's a lot of trees. So San Diego, it'll be more Balboa Park, okay? So Sarasota is less going towards the beaches. It'll be more going towards Mayaca State Park or like to Oscar Scherer Park. So go to where there's a lot of trees. If you're not near a park, there's a lot of communities around you that have a lot of trees. Go over there and breathe, okay? I know we're in a social distancing right now, so the less you go out, the better. But if you can, try to get some air, okay? And maybe it might mean you're driving your car over there, roll down the window, take about 5 minutes of whiff, get the window down, go right home. Might be something like that, but it will be worth for your health, okay? Practice Qigong and Tai Chi regularly. Qigong is the practice, is the art of practicing breathing, okay? When you do that, you're forcing the air that you breathe to circulate throughout your whole body. You're also forcing the blood to circulate throughout your body and lubricate every single joint. As you have more air, more oxygen, and that circulation goes to your body's immune system goes up. So Qigong and Tai Chi, very, very good for you. Tai Chi actually is basically Qigong, but it's called moving Qigong. Okay? So they're the same thing. I talked about EMF blockers and deflectors earlier. We're talking about 5G, definitely something to look into. Avoid using toxic rhythm cleaners, sanitizers, etc. I'll be honest with you, I have a very big worry. I'm very worried because one of the biggest things that, other than washing hands, that has been recommended to people is sanitizers. I mean, second to toilet paper, hand sanitizers is the one that's gone, okay? I mean, sanitizer, at least I can understand. Toilet paper, I don't understand. It's like, why toilet paper, If you don't have toilet paper, just go to the bathroom that's near your shower or something like that. But sanitizers, and the thing is, you have people using Lysols and Clorox and things like that. The main reason is because on the Lysol and Clorox, there's a label that says it kills human coronavirus. Well, they're great at marketing it, but you got to remember, that label came out based on tests they did for the original coronavirus back in the 2000s. That was SARS. That's not COVID-19. It's the same family, but that doesn't mean you kill it. So don't suddenly go out and fall for that and say, I'm going to buy this. My worry is this. There's enough, and there is enough research outside to show how much damage the the cleaners, the commercial cleaners have on your body. Well, can you imagine today? I mean, think about it, okay? If you go into your grocery store, you know, Vaughn's in San Diego, Publix in Florida, okay? How often do you think they clean the shelves in the past? Once a day, maybe? How often do you think they clean the shelves now? Maybe once every 5 minutes, once every 10 minutes? How often do they clean the counter that you were on? 5 minutes, 10 minutes? They're using commercial products. Well, guess what's in the air? All the toxic chemicals. You are inhaling that. That's another reason why you should have your masks try to not inhale that, because the toxic chemicals have been known to cause all kinds of damages in your body. What I worry is once this mask is over, the next bout of tidal wave that is right on the horizon is all these health conditions you see on the screen caused by the inhalation of all these toxic chemicals. You are now doing sanitizer on your hands. The sanitizer dries up your skin. When it dries up your skin, what do you think happens to your pores? They open up and they stay open. They are now more bacteria bound. You are now exposing yourself even more. Don't you sanitize it? Okay, so I'm not saying don't sanitize. I'm saying start looking into using natural products. This is the part that I'm worried about, is what's going to happen after this. We're going to see a whole flux of people having problems caused by the excessive use of these toxic chemicals. So, humidify the room you sleep in, okay? A lot of people don't think about it. You want to keep your lungs dry. How many of you sleep like this? Right? Why do that? Because you can't breathe or your lungs are dry. When your lungs are dry, you open your mouth and the bacteria comes in. So what do? Best thing to do, humidify your room. You can use essential oils using the diffusers. Use like lavender and mint. Those are really good. You can also just get a humidifier. Just put a humidifier, mist up your room, and keep it nice and humid. And then you sleep well. Okay? Avoid letting pets roam around on their own. Okay, now this one people don't think about. Pets, until today, animals they thought could not carry COVID-19. So this tiger may be a rare case, maybe not, don't know. But pets so far have not been shown to carry the virus. But, I mean, to get affected by the virus, but they are big carriers. Think about it. Let's say you have a cat and you go to work in the morning. You let the cat out, okay? You get 4 cats, okay? so you let the cat out, okay? So the cat jumps all over. The cats are very independent. They'll always come home. So in the meantime, they're out there. Well, where do you think the cats rub their back? On what walls? Or what floors do they roll on? Or did they walk past people just sneezing? Or what if people went and pet their fur? Then you come home from work, they come in, and you say, here, kitty, 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 kitty. Oh, nice kitty, you got the kitty. The kitty, oh, and guess what? Now you just kiss everything that was on their fur. And if that's not enough, you take the cat and go to sleep with the cat. So now you put the cat right next to you, and you smush the cat in your face, and you start breathing inside there. So the cats are big carriers, okay? I'm not just cats, but pets, okay? So when you are taking your dogs out for a walk, same thing, go through that same round in terms of making sure that their paws and stuff are sanitized, okay? Because they are still stepping on stuff. And at this time, it's best not to let them roam around on their own. If you let them roam around, make sure you clean them before you start hugging them, okay? Clean your nails frequently. We talk about cleaning our hands. Make sure you clean your nails, okay? And this goes for both men and women, because these days men have a lot of long nails too, okay? So underneath that nails, there's a lot of bacteria there, all right? Clean your cell phone. A lot of people don't think about that. I say, clean your cell phone. Wash hair at night before going to sleep. Okay, think about this, okay? When I came here from China, I was always wondering why people wash their hair in the morning. Why not at night? Why? Because it makes no sense. Because you go to work, you go out in the daytime, you come home at night. In China, we wash our hair at night. Because you come home, your hair is dirty, got all the yuck inside there, you go wash your hair, you go to sleep. But here in the US, you come home, you're dirty, your hair's filthy, you go lie on the bed, you smush your head all over the pillow, and then you smush your face in the pillow, and you get everything, and then you wake up, you already have all the bacteria inside your body, and then you go wash it. Doesn't make too much sense. So if able to wash your hair at night before going to sleep, especially now, you know, if we're not going out, it's okay if your hair is messy in the morning, okay? So if you even during work days of say, I wash my hair at the daytime so that I want to look really beautiful, well, you can always wash your hair at night. Don't use the conditioner. Then you wake up in the morning, use the conditioner, and then do fufu. Now you're healthy and beautiful, right? And the last one here, practice clean sex. This is important. It's one thing people don't think about, okay? So, and especially this one has effect. Remember I was talking about, you know, the virus can penetrate via openings in the body, especially for women. If you have a male partner, okay, think about this. The men, when they go to the bathroom to pee, okay, they have to use their hands to help support the peeing function. Well, men wash their hands after they pee. No one washes their hands before they pee. So think about everything they have on their hands. They go pee. Same thing with women. How often do you wash your hands before you pee? You always wash your hands after you pee. So all your bacteria is down there. Okay? So if you don't wash your hands after you pee, women, it's the same thing as the guys not washing their hands after or before. Okay? If they don't wash their hands and their little device down there gets that dirty and comes home to you and you say, oh, honey, come here. And then you guys go and have fun. Well, everything that was on that device now just went inside. Not a good idea. Same thing for the women, okay? So before you guys have any fun, highly suggest, you want to have fun? Go clean first and then come on and have fun. Okay, at this time, even more important. Okay, so from here, those are the things I really wanted to share with you. Of course, with the COVID-19, the lockdowns and the stay-ins type thing, I'm trying to figure out ways how I can help my patients. So this is what I'm going to be doing. First of all, I'm setting up a thing called telemedicine. And I'm setting up a HIPAA-compliant virtual clinic. I will be able to do online consultation for those people that need to talk to me. Based on a consultation, I can have herb and acupressure prescription. So basically, if it needs acupressure, I will teach the patient how to do acupressure on themselves. And if need herb, I can prescribe the herbs. The herbs can be curbside pickup, so there's no physical connection or things like that. And I'll also be doing nutrition lifestyle consultation. So the first step to that would be for the people to contact me at my phone number. And then when they contact me, then what I would do is then I would put them on the schedule, and then I would then, at that time of the appointment, get on this HIPAA compliant platform, and then we can talk. And with this telemedicine, I'm not restricted to just Sarasota. I can basically help anybody, even as far as Africa. Okay, so I will post this on Facebook, okay, and probably sometime tomorrow. And the second thing is I'm going to be giving online webinars, okay? This is what I have put together. I'm going to be giving this based on surveys that I've done. A lot of people are very interested in knowing how to select foods for health, not for taste. So how does food affect our body? So I'm going to have one webinar on Chinese food therapy. I have one webinar totally talking about teas, how teas work, what kind of teas help the persons, what kind of health. I've been asked to give Qigong class. So I'm going to have a Qigong class in the morning. I haven't decided how many days yet. So we're going to do Zoom. So basically, I'm going to have the Zoom and my lanai. I'll be out there doing all kinds of crazy things. And then you'll be over there on your TV, watch me do the stuff and following me. I'll have a webinar helping you understand how your body works, how the organ works, and what you can do to actually boost your immune system. And then I will have one class that I'm going to be talking about between 15 to 20 of the most powerful pressure points, acupuncture points that you can actually use with your finger to treat yourself and help yourself. So those are the 5 classes that I will be putting together and announcing. And we'll start getting that going in the next week or so. And I'll be announcing them on Facebook, okay? Well, what else can you do? Check up on your friends right now. It's like you say, I'm bored. I don't know what to do. I'm really bored to tears. Well, check up on your friends. We all have friends. At least I like to think we all have friends or know there are people that have friends. What about the ones that are elderly? The coronavirus lockdown is not that bad for people that have at least another person in, but for people that are by themselves can be very lonely. So we know someone like that, reach out, call them, cell phone, Zoom, whatever, okay? So do a good deed. Pick up a hobby or a skill, cooking, sewing, music instrument, dance, creative arts, etc. Get in shape. I see all these Zumba and all these classes going up all over the place, no more excuse, I don't have time. You have plenty of time now, okay? So build your business infrastructure. A lot of us are small business owners. We say, oh, I really need to build a website. I never have time to put the content and stuff. Well, guess what? You have plenty of time now. It's a good opportunity for you to relook at that so that when this mess is over, your business can come right in. Help out where safe and needed. Making masks, there are a lot of people, masks is a shortage. You see people, the wonderful thing that's coming out now, there's so many people offering to make masks using bras, NTs, any kind of stuff. They're making that. And guess what? These are being used. So if these are being used by the general population, then if the nurses are the ones or the doctors are the ones being really close up, yes, let them have the N95 mask because they are that close. But that doesn't mean our lives are that much cheaper. We don't need it. We need it, but we're not going to be that close to the people that we need to have that strong of an N95 mask. So a good option is by helping building and making masks. There are some churches, I'm going to be going with my wife this Friday to help out a church for helping to load food donations into trucks and stuff like that. They're practicing social distancing and everyone's going to be a mask, everything's clean, and there's going to be drop-off zones and stuff. So make sure it's safe, and it's safe. Go out, do stuff, okay? Help out. Take online classes. You ever want to get a degree? Now's a good time, right? You want to read? Now's a good time. Those 5 books sitting on your desk for the last 5 years, now's a good time to read that. Spend quality time with your family, right? Exactly. Spend quality time. Now's a great time for that. Daily devotions, okay? For those of you that are Christians or that believe in a certain entity and stuff, daily devotions is a great time to just sit back down, meditate, and regroup and revisit. Who are you today? Who were you? Who have you become? Who are you now? Is this the best you? What can you do? Lots of daily devotions, lots of daily reflections. Take this time to do that. Clean up, reorganize. I have my garage targeted for that. I told my wife, 5 days we're in your garage, we're tearing everything down. She said, yes, I'm gonna try to get you to do that for 10 years. So and then call up old friends. Hey, this is a great time to rekindle old friendship, right? You haven't called a friend in 6 years. That's okay, better late than never. Call them, chew you out, and after that you become good friends again, right? So, or simply just chill, okay? So remember, I will leave you with this note. The key to battling COVID-19, strengthen your immune system. And yes, you need to prevent the virus from spreading. But number one is strengthening your immune system, okay? So that's pretty much what I have. Anyone have any questions? Good?
Great job.
All right, good. So on the what you say?
Someone said something. Great job.
Oh,
Yeah,
thank you.
great job.
Thank you.
I have one question. Question about the level of contagion of this virus, since it's a novel virus, and the fact that it's actually more contagious than, let's say, some other viruses. I don't know if it is. I guess the question is this more contagious because it is a novel virus?
It's more contagious not because it's a novel virus. It's more contagious because, number one, it enters via the lungs, and those spikes damage the lungs. And your lungs are the initial keeper of your immune system. If you have weak lungs, the virus will enter. So whereas a lot of flu and stuff, they won't necessarily attack the lungs because they don't have those spikes. This one comes in and attacks the lungs, makes the lungs weak. That's why it's important for all of us to do additional things in the background to strengthen the lungs, strengthen the supporting organs, the kidney and the spleen stomach. If not, yes, it's more contagious. If we are able to strengthen those, then it's not as contagious. We have control.
Is the presentation available online, or will it be?
Do you guys want to make it available online? Yeah, I'll go ahead and try to convert it, and then I have a YouTube channel. I'm going to put on a YouTube channel, and then I'll post it on the Facebook there once I get it converted, and then you guys can share it out. Huh?
Thank you. Thank you very much.
Thank you.
Thank you.
And then feel free to share it out. Yeah. And
Yes. Thank you very much.
Oh, my pleasure.
Thank
So
you.
my Facebook community page is Dr. Rene's Natural Health Pearls. I'm going to keep posting stuff over there. I have my own personal page, Rene and Chinese Medical Solutions. Most of you know, I'm just trying to share as much stuff as I can.
And you'll let us know when we can come back to see you again for treatments.
Absolutely,
Please.
I would. Yeah, absolutely, yeah. Like I said, the virtual clinic should be live up and running in a day or two. Okay, so that at least will get going. I already have a bunch of my patients. I'm starting to deliver herbs to them on a curbside. Some of them are here, and they'll tell you it's kind of like playing James Bond. You know, it's like this is how it worked this week. I had one patient. I met her at Walmart near a certain location, but I told her when she got there to call me. So I'm sitting at Walmart. So she gets there, she calls me. I say, okay, are you at this Walmart? She said, yes. I said, do you see the front door? She said, yes. I said, now pretend your back is to the front door, look straight. You see the blue sign at the end of that aisle of parking lot? She said, yes. I said, do you see the little cart at the bottom of the blue sign? She said, yes. I said, I just placed the herbs in that cart. I'm going to watch you go over there and pick it up so no one else does that. so she goes over there, picks up that cart, picks up the thing, and I say, okay, you got that, I'm watching you. I roll down my window, I'm on the other side of the parking lot, I'm going up, waving my hand as she waves her hand, and done. So we did the transaction, the dollar-wise over the phone, so there's no contact at all like that. So she's safe, I'm safe, everyone is safe like that, okay? So that's what I mean by curbside drop-off.
I think there should have been a roll of toilet paper involved. Thank you, Renee. My name is Kathy Grippy, and I was invited to listen to you by Heidi Breslow.
Yes.
And I'm really delighted that she did invite me, and I hope that you might be welcoming some new people to your practice, even while you're doing distance. I think you and I could definitely resolve some issues that I'm challenged with.
Absolutely, yeah.
But beyond that, I want to offer everyone an invitation. I'm a laughter yoga leader, among other things, and I run laughter yoga sessions.
Excuse me.
All about the lungs. They're all about the lungs and giving ourselves the opportunity to produce the good chemicals, the good endorphins, the dopamine, oxytocin, serotonin, and endorphins. And I invite anyone to Zoom with me and start searching for laughter Zoomers on Facebook. I've been laughing with people all over the world, quite frankly. So if you're at all interested in laughing with me, I currently do a session on Wednesday mornings and Saturday mornings. I'm open to doing other groups as well. I don't charge any money. It's a fun thing, and you can find me. It's very easy. LaughterYogaVenice.com. So you guys are, I think, are a great group of people who get. We need to get more oxygen in our lungs, which means we'll get more oxygen throughout our body, and we don't have. Doesn't seem like we want to do it while we're sitting home.
Yes, and one thing, Kathy, is you brought up one thing in terms of laughter. In Chinese medicine, all the organs are also associated with certain emotions, okay? For example, the liver is associated with anger. That's why people, when they drink a lot of alcohol, they can get from anger on 1 second to sadness on the other. when you go to a funeral or someone's sad, you will never see someone walking in like this. You don't see them walking like that. The shoulders hunch forward. Sadness affects the lungs. And we already talked about the need to keep the lungs healthy. So guess what helps us with the lungs? Laughter.
It's the best medicine.
So Kathy is right on with that. She's right on. So we have to take advantage of that. So thank you, Kathy. That's wonderful.
You're quite welcome, and I look forward to laughing with any and all.
Right.
All right.
Thank you.
All right, thank you guys. Well, you stay safe. You can always message me. I'm on Facebook. Message me anytime you have questions. My patients will tell you that drives my wife crazy, but I kind of like I'm a 724 support center myself, so I try to answer questions as I can. So if you have questions, don't hesitate. Message me and things like that. Okay, and I'll answer.
I just want to say one last thing about the pendant and the pyramid I held up. It's by Shungite, which is found in Russia, and it really is supposed to for the emittance of all the stuff and the 5G that's coming at us. So I've been wearing this for a long time, and I've had a pyramid next to my PC forever. So
that's awesome.
But Shungite, look it up, and comes from one place on the planet in Russia. They've been using it for years. We put it in the water. It's fabulous. So I'm a believer in Shungite.
Heidi and Kathy, why don't you guys go on my Facebook page and just type in that name over there. That way people can know from there and everyone can see. That sound good?
Thank you, Dr. Ring, and God bless
you're
you.
welcome.
Thank you, Dr. Rene.
Everyone.
Dr. Rene.
Okay.
Bye.
Bye.
Bye. Bye.
Okay.
Thanks, Heidi.
You're welcome.
Thank you, Heidi.